Hey, ladies, we want you to mark your calendar for October 5th through the 12th, 2025, because we're taking you on an epic pilgrimage to Crete.
That's right. We're doing a beautiful retreat called Awakening the Goddess, where we are going to nurture ourselves from the inside out. You're going to be learning all kinds of sacred sexual practices from both the Taoist and the Tantric perspective. We'll be doing yoga every day. We'll be going and visiting sacred sites and really harnessing the energy of the primordial goddess, meaning the original divine feminine energy that is so alive on this island. I was just there last year and it was a game changer for me. And I was like, Leah, we got to put together the retreat that I want to go to. So this is it.
Yeah, there's something very special about women coming together and healing and awakening each other's Shakti to really resolve some of the blocks, some of the hurt, some of the traumas from the past, to shed that dead weight so that you can become more alive. You can become more magnetic, cultivating trust, cultivating vulnerability, cultivating presence, coming into a new state of consciousness in the arms of a group of really amazing women, sisters, and friends you're going to have for a lifetime, including Willow and I. So join us on the plane. Let's get this party started. You can sign up at sexreimagine.com and let's go to Greece, baby.
What if everything you've been told about aging and sexual health is scientifically incorrect? Today's guest has discovered breakthrough approaches that are helping men in their 60s reclaim the sexual vitality of their 30s without the blue pill. We are here today with Dr. Judson Brandeis, award-winning urologist and sexual medicine pioneer, and we are thrilled. I'm Dr. Willow Brown. I'm here with my amazing co-host, Leah Piper, and we are so grateful for all your wonderful likes, shares, and subscribes.
Okay, friends, you know what to do. The time has come. Let's tune in, let's turn on, and let's fall in love with Dr. Brandeis.
Welcome to the Sex Reimagined podcast, where sex is shame-free and pleasure-forward. Let's get into the show.
Welcome to the show. We're so
thank you for having me here. This is such an honor to be here.
Yeah. So you've been in the world of sexual medicine and helping men with their virility for quite a long time now and have studied extensively. You've written a book. You've got a podcast coming out. So many good things to share with us. Why don't we start with where this all began for you? What kind of got you on this sort of track with medicine?
Yeah, the world of sexual medicine.
Yeah. So as a urologist, I've been a urologist for 25 years. Sexual medicine was always sort of part of what we did, but I started out first interested in kidney transplantation and then became really interested in prostate cancer. I was a pioneer in surgical robotics for prostate cancer. And then I built the Kidney Stone Center and then MRI guided prostate biopsies. But about 6 or 7 years ago, I became really interested in the use of regenerative medicine to help men who no longer were able to get adequate erections for intercourse to get them back on track. So using low intensity shockwave therapy or PRP or even stem cells and supplements to help men turn the clock back 5, 10, 15, 20 years.
Wow. To turn the clock by 2 decades, that is very significant. I just imagine that you've got patients just filling up your calendar. So many men that I see are noticing that they can get hard, but they're having a hard time staying hard as they get into their 50s and 60s. And we've just been, we've had a couple guests on talking about stem cell therapy, which was new to me. What can you say about stem cells?
Yeah, so stem cells is kind of a generic category for a type of treatment that utilizes either a growth factor or the actual cells. But a lot of people think when they think stem cells, okay, they're going to inject these cells and these cells are going to start growing in my body. But as it turns out, most of the data points to the fact that stem cells contain what are called growth factors. So chemical messages that the cells send to other cells to make those cells grow. So within our own body, we're loaded with stem cells. That's how our hair grows. That's why our intestines grow. That's how the cells inside our mouth grow. Really, anything in your body has stem cells. And so it's more of a function of stimulating the stem cells that are our own stems, endogenous. I was going to use the word endogenous, but I didn't know if anyone knew what that meant. But
already inside your body.
Yeah, there you go. The stem cells that are already inside your body to grow into the tissues that they're supposed to be, whether it's blood vessels or connective tissue.
I can't remember if it was Dr. Elliot Justin or Dr. Gittins, who we've had on the show, who described the process as it's like the stem cells are the chicken in the chicken soup, but it's not like it's the chicken that is going to make the stem cells work. The stem cells are really about the broth. And so it's the broth is coming into your tissue and it's working with your own stem cells. Is that an adequate explanation if I was going to give you a metaphor?
Yeah, I mean, I think that's a pretty good explanation. They've radio labeled stem cells that they put into animals to see how long they stick around. And they stick around anywhere from 1 to 4 regenerations. And then those cells are gone. And so it's really the growth factors that the stem cells are releasing that are causing the growth of the native tissue.
And so when you say growing the native tissue, how is that helping with erectile dysfunction? What is the actual function of this intervention? And can you explain that to me?
Yeah, well, erectile function really is physiologically, it's a function of circulation, right? So we all know, and you guys know better than I, that there's a whole psychological aspect to it. But I'm speaking purely physiologically. It's the ability to pump blood into the penis and expand what we call the corpora cavernosa, or the erectile body, to the point where it occludes the veins that empty out the corpora cavernosa. So there's an artery called the deep cavernosal artery that pumps blood through the middle of the erectile body, and then the blood drains on the periphery. And as the pressure increases, it blocks the venous return back to the body and traps the blood in the penis. And that's how you get a penis that's rigid enough for penetration. Mm. And so it's all about raising the blood pressure in the penis. And so you can do that by boosting the signal. And so there's a molecule called cyclic GMP, which starts a cascade of events that leads to blood vessels opening. And so you can use nitric oxide, or your body uses nitric oxide, to increase the amount of cGMP. And so I have a supplement called Affirm, which is a nitric oxide booster. And last year at the Sexual Medicine Society meeting, I presented data that Affirm alone, taken before you go to bed, using Elliot Justin's FirmTech ring, showed that you can increase erectile function 33% at night.
Wow.
Just by taking.
Wait, okay. So what's in Affirm?
Affirm. So there's 2 ways you can boost nitric oxide.
Yeah.
One is the citrulline-arginine pathway. And so Affirm has a lot of citrulline in it. And then the other is the nitrite, nitric oxide pathway. And beets have a lot of nitrate in them. So there's beets, ginseng, and mirapoama. Mm-hmm. So you want to be activating both the citrulline-arginine pathway and the nitric oxide pathway.
So is it working on like proteins, amino acid? Is that the...
No, it's creating nitric oxide. And nitric oxide is the second messenger that nerves release onto blood vessels to cause blood vessels to dilate, to open up.
Great.
And that's true. That's true all throughout the body. What?
The Affirm is your own formulation?
It is my own formulation. What? And I was actually at UCLA when Lou Ignarro won the Nobel Prize for discovering nitric oxide as a second messenger. And then he and one of my professors, Jake Rafer, actually wrote the paper in the New England Journal of Medicine describing the mechanism of action of Viagra.
Now, my understanding of nitric oxide is that it also brings a flush to the body, right?
Well,
don't people get a pretty intense flush?
Yeah, well, it's a vasodilator. So it opens up blood vessels. So it improves people's blood pressure. So, I'm constantly getting men off their blood pressure medication because for the most part, blood pressure medications are bad for erectile function.
Right.
So if I can get them on a natural blood pressure medication, like a nitric oxide booster, like Affirm, then it helps improve circulation in the penis and it reduces their blood pressure.
Is that what you're
Now,
using then to get them off of blood pressure medication? Is the Affirm?
I am. And it's really amazing. I had a patient the other day, he had elevated blood pressure and he was seeing a cardiologist at Stanford. And I said, do me a favor, before the cardiologist puts you on a blood pressure medication, I want you to take 2 Affirm pills twice a day and monitor your blood pressure. And his blood pressure went down to 120/80.
Yeah.
And
Maybe.
the Stanford cardiologist was flabbergasted. Like he had never heard of this. And, the reason no one's ever heard of it is because you really can't patent it. So there's no real reason for drug companies to sink $100 million into a study if they're not going to make any money off the and that there are a lot of supplements out there that are kind of useless, but nitric oxide is not one of them. It's very, very, very well researched and very well established. And it's been shown in athletes to improve athletic performance 3 to 5%. It's been shown to improve cognition. It's been shown to improve blood pressure. And also, of course, it improves erectile function.
I remember my husband used to take it before workouts. I don't know if he still takes it, but I have a couple questions. One, how does someone order Affirm?
If you go to Affirm Science, AFFIRM Science.com, it's
Great.
super easy to order.
We'll have that in the show notes. And
Awesome.
then what about women taking this product? I mean, we've
Yeah,
got a lot of erectile tissue. We want to get fluffed up and turned on.
You get firm.
Any mammal.
We want to get firms too.
Yeah. Well, vaginal and clitoral blood supply is really important, for lubrication, for sensation, for sort of clitoral erectile tissue. So it's critically important in women, and not just for sexual function, but also for physical
Right.
function, for blood pressure, cognitive function.
So can women take Affirm?
Yeah, absolutely.
Now, I had a friend give me nitric oxide. Is that what it is?
Mhm.
And I got so hot. I got so flushed. My skin felt like it was on fire. I actually really hated it. I'm just assuming she gave me too much.
Either much or you can do that. Arginine will do that.
Yeah,
So-
L-arginine. Yeah, I think that's why.
So a better thing to take is citrulline.
Is
And
citrulline?
then citrulline is better absorbed by the intestines, and then it's converted into arginine in the kidneys, and then it's recycled back to, there's a citrulline arginine cycle.
Okay. So citrulline. Now, your supplement, can women take that too, or is it really designed for men?
No, both.
Both.
We can take
Okay.
Affirm. It's
I'm so
Yeah.
excited. I
Yeah,
can't
there's
wait to
actually
try
a pink labeled Affirm, but it's the same
what would you say
formulation.
what about the peptide PT-141 for sexual function and health? What's your
Yeah, that's a great peptide. I have a lot of my patients on that. It gives people spontaneous erections. So,
Right.
and the other thing is it's a little bit less predictable than, say, Viagra or Cialis. So Viagra and Cialis, you take it and you can pretty much set your watch by it. 30 to 45 minutes later, it kicks in. Whereas the PT-141, there's 2 ways you can take it, either as a nasal or
Right.
subcutaneous injection. The nasal has fewer of the side effects, which are mostly like nausea or kind of upset stomach, but it's a little bit less effective. And then the injectable, it's a little bit more effective, but it does give about a third of folks pretty bad nausea. I had a patient, the couple took it, and it was at New Year's, and she was saying that like she was basically out throwing up for the New Year's.
Oh,
So,
that's is
Yeah.
I have tried it
very
once.
so specific. Like you have to
it is dose specific. And the thing is, it's FDA approved for women. It's called Vyleesi.
Hmm.
And so it's a very, very safe drug. It's got FDA approval. It isn't FDA approved in men, but that's just because it's hard to compete against $1 Viagra.
Now, is this peptide that also increases melatonin in one's skin?
Right.
So a
So
lot of
it's-
people's
it-
skin color is changing?
Yeah. So it was being developed in Australia as a sunless tanning agent.
Oh, really?
Because so many people there get skin cancer. And so they were giving people this peptide every day. And so they were starting to get darker skin, but they were also like horny as hell. And so
You're like, where's
hornier than the average Australian anyway.
boring?
I love this idea of everyone just getting hornier. I'm
Yeah.
very sex positive in that direction. Let's get juicier.
But
folks.
it's a little unpredictable in terms of when it works. So if you take it at like noon, it may start working at 1 o'clock. It may start working at 4 o'clock, and so it's more of like a weekend away kind of drug than.
But isn't it also like an ongoing treatment, like where you would do it kind of like once a week for several weeks?
I thought it was as needed, though. You don't.
Yeah, it's more of kind of as needed.
Or as needed?
Yeah,
thing.
like you're going to be on a hot date.
Every week, then you take it every week.
Yeah, right. How long does it last in the system?
Yeah, that's also pretty variable. I've had patients tell me, 2-3 hours. I've had patients tell me, 12 hours. I've had a couple patients who were kind of younger and healthier tell me that they had an erection that lasted almost like 6 hours.
Wow.
Yeah, my former business partner, who is 75, has been taking it on a pretty regular basis, and he's like, I'm getting spontaneous erections when I'm driving my car.
Right.
It's amazing. He's like, I feel like I'm 30 years old again. He goes, it's awesome.
Yeah, I mean, you certainly don't necessarily have a lot of control. I mean, you could be watching like a Margaret Thatcher documentary and all of a sudden get an erection.
Let's take a quick break.
Ladies, do you want to explore your sexuality and experience true sexual healing?
The Vaginal Orgasms Masterclass teaches you and your partners how to unlock your full sexual potential and awaken the G-spot, the sacred spot, and the cervix for an unforgettable sexual experience. Would learning how to finally surrender and release grief, fear, and uncertainty benefit your outlook on life, love, and relationships? We certainly think so. Common misconceptions of the G-spot, including its anatomy and function as an erogenous zone, will be covered in this course.
Plus, we're going to teach you 7 different massage strokes for the G-spot that dissolve blocked energy and increase your pleasure tenfold.
We're going to teach you how to locate the sacred spot and the best methods to stimulate it for maximum pleasure.
And you're going to learn about cervical orgasm techniques, which are the most powerful and also often elusive style of climaxing. This class is primarily geared toward women, but men have taken it as well and learned so much about how to pleasure their partners.
So get ready for multiple O's, my friends. And you can get all of that at sexreimagine.com/female-masterclass. And for being a listener of the show, we've got a beautiful coupon code for you. It is 20% off this course. Just type in podcast20, that's all caps, podcast20, and get yourself a great deal on this on-demand course. Yeah, so, I'm sure that there's a lot of guys who are actually missing those volunteer erections and are missing the hardness of their erections.
Now, is that going to work well also for people who've had prostatectomies or prostate cancer?
Yeah, good question.
Yeah. So if you've had prostate cancer and you had a non-nerve sparing prostate cancer surgery, then it's not going to work because it relies on nerves to send a signal to the penis.
Okay.
And so in those patients, you really have to do something like injection therapy or a penile implant.
Okay.
Okay, I really want to get into your work with expanding girth and length for men who are insecure or subconscious or just long for having a bigger cock.
And it's really interesting. It's really interesting because when we did the P-Long study, I was kind of expecting all the participants to be sort of below average length for men. In the United States, the average length of the erect penis is 5.1 inches. So I figured everyone would be below 5.1 inches, but it wasn't. We had about a third of the study participants were below that, about a third were around that, and about a third were larger than that. So
how many participants in the study?
We had 30 participants.
Oh, okay.
Yeah.
Well, yeah, that's interesting. That's actually not surprising. People who I've been working with for years, men, and I would say a lot of them this might surprise women, or maybe not, but a lot of men, a high percentage of the men who come through my office have insecurities about their cock size. And I've seen a lot of penises, folks, and I'm proud to say that I've had the privilege of that. And I'm looking at some of these, we call them lingams in Tantra, and going, you are perfectly beautiful. You have a lovely size. Yeah, you're not giant, but you're not teeny. Like, it kind of boggles my mind at how much men are insecure about their size. Women don't think about it nearly as often as men do. And do you think that that's just a result of porn? This obsession?
Yeah, I think that you're right. I think men care more about penile size than women do. And yes, it may be secondary to porn. It may be just like one more thing that guys use to compare with each other.
Yeah.
And to be honest, like, I don't really care how big guys' penises are. That's not my thing. But what I do care is that men don't do stupid things to hurt themselves in the pursuit of an enlarged penis. And so, as a urologist, a surgeon, and a sexual medicine expert, I would see men come to my office who've had surgeries, who've had fillers, who've had fat transfers, who've had ligament ligations, with really disastrous consequences. Like guys with like you said, a perfectly normal functional penis. The function of the penis is to procreate and to urinate. So if you can urinate and procreate, your penis is fine. But that's not what society tells us. And so guys do things and spend lots of money on making their penis bigger. And so what I wanted to do was to create a study that would figure out a way to increase the length and the girth of the penis in a way that was totally 100% healthy. And so I put together a study. I've done research at Harvard. I've done research at UCLA. I've done research at American Red Cross. So I know how to do research studies. We got Institutional Review Board approval. We had it listed by the NIH. I presented the data at the International Society of Sexual Medicine and the Sexual Medicine Society of North America. It's written up in Andrology, which is a reviewed journal. And what we found was that in the 30 men in the study, we increased the length of the penis about 0.8 of an inch and increased the girth of the penis about 0.5 an inch over a period of 6 months. And the most important thing is there wasn't anyone that had any negative side effects. And everyone in the study felt like they had better erectile function.
Really?
Did they feel like they had more sensation as well?
Subjectively, yes.
Mm-hmm.
But we don't really have anything that we can measure sensation with. And so, it's purely a subjective thing. Also, the improvement in erectile function was also purely subjective because these are by definition men that have normal erectile function. So we don't have a survey instrument to measure an improvement over what's already normal, other than, guys know when things work better.
Yeah. I'd be curious to know if there was a group of men who was frustrated with their ability to get hard was fine, but their frustration of being able to stay hard was challenging. And if that helped them stay hard to the point of being able to finish.
So, PRP and shockwave therapy will help men do that. But in the study, we weeded out anyone that didn't have perfectly good erectile function. Because the thing is, men get 30 to 60 minutes of erections every night. That's one of the things that I discovered in a real way when we did the Confirm study, which is the use of Affirm to improve nighttime erections. And to the really, 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 really exciting study is the Confirm 2 study, which I just literally got data on yesterday from my statistician, which combines Viagra, a small dose of Viagra, 40 milligrams, with Affirm. And I can't spill all the beans, but the data is really exciting. And the great thing is a lot of men will have side effects from taking a dose of Viagra or Cialis that's too high. They'll get facial flushing, they'll get headaches, they'll get reflux, they'll get stuffy nose, they'll get muscle aches. And so if you can use a nitric oxide booster like Affirm to augment the effectiveness of Viagra, then you can take a dose that's effective, but it won't give you that level of side effect.
Oh, that's cool. That's a good combo. I like that.
Yeah. What's the What is P-long? Like what are men actually doing to increase the length and the girth?
Yeah. So there's a stretching device called the RestoreX device that was developed by a friend of mine at the Mayo Clinic. And that's used mostly, it was developed for Peyronie's disease, which is a curvature of the penis, but it stretches and improves length. And then a penis pump by the Dr. Joel Kaplan people, which will improve girth. And then the Affirm nitric oxide booster to improve erectile function and especially nighttime erections. And then the secret sauce is PRP injection, so platelet-rich plasma injection. So what we do is we draw blood, we spin the blood down, the red blood cells go to the bottom, the plasma goes to the top, we take those off. And in the middle, there's a layer of platelets, and those platelets are resuspended in plasma and injected into the penis.
Okay.
And platelets have two functions. One function of platelets are to cause a clot, but the other function of platelets is to regenerate tissue, to cause tissue to regrow. And so PRP is used in hair growth. It's used in, didn't work for me, but it's used in hair growth. It's used in orthopedics. It's used in dental surgery, and it's used in penises as the P shot and
P-shot.
vaginas or clitoris as the O shot.
Okay. That's good to know. I didn't know that. So what's the treatment like if someone really wants to do this? Are they using the pump and the thing that stretches the penis? Are they doing that every day?
I wanted the study to be doable, the protocol to be doable by men. So there was a study out like 20 years ago on a stretching device that you had to wear like 9 hours a day for 6 to 9 months. And that got you about 1 inch in length, right? But most people don't have jobs where they can wear a penile extender for 9 months,
what does it
or 9
look
hours
like?
a day.
What does it feel like?
And so the P-long protocol is using the RestoreX device 20 minutes in the morning, 20 minutes in the evening, and
Okay.
using the pumping device 12 minutes in the morning, 12 minutes in the evening.
Okay.
Right.
So it's about 30 minutes in the morning, 30 minutes in the evening.
Okay.
Okay.
Plus,
And-
how often are the PRP injections?
Yeah, PRP is once a month for 6 months.
Once a month.
Okay.
So
And then
and
how
then
long does this extra girth and length last?
As long as you're getting adequate erections, it should last forever.
Really? Okay.
Yeah.
Right.
So it
now
has
this
permanence.
Person study, you had these guys doing this 30-minute protocol in the morning, 30 minutes in the evening, and getting PRP injection once a month. And how many months in total were they?
6 months.
6 months for the study.
So, we ended the study at 6 months because we were able to achieve a high level of statistical
They're like,
significance.
you know, enough. Yeah.
Yeah. But I mean, we have plenty of guys that have aspirations to be bigger. And so they continue to go and they continue to grow.
Do the protocol.
Yeah. Although I had a patient the other, a couple months ago, and he's like, Doc, this is going to be my last visit here. And I'm like, how come? Like you're doing so great. And he's like, well, I was talking with my wife and now I'm too big for oral and I'm too big for anal and I need to leave at least one orifice open.
Oh my God. That's
I am very sympathetic to her plight. I'm not one of these women who really loves giant penises. I find them to be painful. So yes, interesting. He had to press pause on the protocol.
Yes.
Now, do people have to come to the Bay Area? I know that your office is in San Ramon, or are there clinics across the country?
Yeah, no, we have
who
a
do this?
network of about 50 or 60 offices around the country that offer P-long that are
So
trained
you're
in
training
P-long.
other practitioners in this protocol.
Yeah.
And what kind of who can get certified to do this treatment?
Physicians that are that have a capability of injecting penises, which
Okay.
You have to be a medical doctor or a nurse practitioner. Could a nurse practitioner do it?
yeah, no, we have nurse practitioners that do.
Oh, huh?
Exciting.
Yeah, I mean, technically, it's not prostate cancer surgeries.
Right. But it is something that really shakes the confidence of so many men out there. And I think if people don't know about this, I think the other alternatives seem really invasive. And so that scares a lot of people, and probably it should.
I mean, the alternatives are really lousy. A lot of people do what's called a ligament ligation.
Yeah.
And so the penis hangs lower. But when you get an erection, it points down to your toes, and it doesn't actually increase the length of the penis. What if you look at a penis anatomically, about half the penis is on the inside and half the penis is on the outside. And so when you cut the ligament, it just hangs lower, but it's actually not bigger. So like if you're with a guy and the guy's like, well, I have a 6-inch penis, and then you're in bed with him and you're like, no, you only have 6 inches. He'll say, well, no, I have 6 on the inside and 6 on the outside.
Which is why women are such terrible judges of distance.
I have a question for you. Do you get any intel, or do you talk to your patients about like how this changes other sectors of their life, like their confidence at work, like when they've got more confidence in their cock, how is it changing other areas of their life, their relationship?
Yeah, I mean, we didn't really
talk about that one.
Put questionnaires out there. There are some actually validated sort of quality of life and confidence type questionnaires that we could have used. But I think in general, I notice that men are sort of happier and more confident when things are working much better down there.
So I knew about like the ligament, cutting
Ligation.
of the ligament. Yeah. And I knew about fat injections. Can you say more about the filler? What your thoughts are on that?
So there's collagen, there's hyaluronic acid, there's PMMA. So a lot of those are just bulking agents that like people get put in their lips or people get put in their face. The thing is that they have to be suspended in fluid in order to be viscous enough to be injected through a small needle. And so basically, if you're 50% suspended in water, then within a couple of months, you're going to lose 50% of the bulking almost immediately as that water gets reabsorbed. And typically the fillers will last maybe a year or two, and then you end up with this kind of dry, lumpy, bumpy penis. Almost feels like sand under the skin of the penis. And then you have to go back and get more fillers placed. And they're not cheap. It's usually $10,000 for the initial injections, and then $2,000-$3,000 every couple of years for additional injections.
Wow.
And so it's expensive. It's temporary.
That's a good business.
And the other thing is it gives you girth. It doesn't give you length, and it doesn't do anything to the head of the penis, right? So now if you have big girth and a little head of the penis, what I call that, scientifically, we call that a pig in a blanket penis.
Scientifically.
That's so, yeah. I mean, pig in a blanket is great at a cocktail party, but it's not great in a bedroom.
Wow. That's
and the other thing
funny.
is, I mean, and you guys tell me, but I don't think women are looking in particular for the size of the penis. It's more like the confidence of the man who owns the penis.
Right.
And so if you're in bed with a guy and you're like, why does your penis look like a pig in a blanket? Or, why can I feel this, silicone implant under the skin of your penis? I think that will reflect more poorly on the guy than actually having a penis that's on the smaller side.
Well,
yeah. What we try to do sort of energetically, emotionally, and psychologically for men is to help them connect to, it's not how big you are that makes you a great lover. It's how much love and consciousness and power you can put out that penis. And so it's much more a mind-body connection to go, how big do you want to be? And using the power of your mind to, bring that forward. And that leads to a lot of success in terms of how magnetic and attractive and potent that man feels when inside of you. But, again, one has to use very specifically the power of their mind to be able to own that. And sometimes people can't dig that deep to be able to feel their versatility in that way.
Yeah. Yeah, I totally agree with you. And, you said mind-body connection. It just made me think of something totally off the subject. But my book, The 21st Century Man, it's the most comprehensive men's health book ever written. And So I started a podcast using artificial intelligence to create podcast episodes. And I thought it would just like basically take the chapter, synthesize it, and kick out a summary. But the really, really spooky thing is it read the whole book. And then the podcast, I was listening to the podcast to make sure it was okay. Because you have to we spent a lot of time working on the prompts to figure out how to get it just right. And AI was like, this is the first men's health book to emphasize not just men's physical and sexual health, but also the mind-body connection.
Mm-hmm.
So AI has insight. It was crazy.
Well,
I'm listening to this,
book. Don't you talk about the mind-body connection in your book?
not using those words. There's a whole section on relationships. There's a whole section on mental health. There's a whole section on lifestyle. There's a whole section on aesthetics. And so there are large parts of the book that relate to that, but I never had anyone kind of synthesize the book to me and say, wow, this is really an amazing book, emphasizing not just physical health, but also sexual health, the mind-body connection. So it's really
Pretty profound.
what's going on out there is it's crazy.
Yeah.
Yeah.
We're going in this world. Pretty wild. Well, who knows what the penis is going to experience?
Exactly.
So yeah,
Well, they're trying to achieve artificial general intelligence, but maybe they'll also achieve artificial penile intelligence, right? Because everyone says the penis is the second brain.
yeah.
I don't think the IQ that they'd have to hit would be quite as high as for the.
Probably not. We're simplifying. Yeah.
I don't know if you'd have an answer to this question, but I've heard that as men age, their oxytocin levels go up. Where women, as they go into menopause, their oxytocin levels go down. And there's one theory that it's why there's a lot of men, older men and younger women who tend to be attracted to each other because their oxytocin levels are starting to match up. It's one theory. And so intimacy, feeling really connected to a person as men are older, that connection becomes more valuable. It's more important than maybe some of that more exciting or shallower sex where they're just going from one partner to another partner where connection isn't as vital. It's really the desire and the friction that's the big turn on. And as men age, that need for connection is greater. And emotionally, there's a connection between that and their penis responding. Have you heard of anything like that? Do you know if that's true?
I would think of it more as their testosterone levels and then their testosterone levels coming down and then the estrogen levels also in women coming down. That sort of connecting
The
point.
interplay.
Yeah, I mean, what both of you are saying makes a lot of sense to me. I think that, from my own sort of patient's perspective, as you hit your 60s and 70s and 80s, your erectile function, erectile stiffness isn't what it used to be. And so you have to become more creative in terms of the way that you pleasure a woman. And so, connecting with them physically in a non-penile penetrative way becomes more important. And oxytocin may help with that.
Is that true? Do you know, do oxytocin levels rise as men age? And
Yeah, that I don't know.
as women age?
I want to segue to the prostate and ask you about prostate massage as an intervention to help with prostates that get swollen, to help milk the prostate for just greater health. Of course, there's a lot of sexual benefit for men who get turned on by prostate massage. There's a hypogastric nerve in that part of the body that can carry orgasmic energy up to the brain. Is there anything you can share or enlighten us when it comes to that, either as a preventative medicine process for keeping the prostate young or just from a pleasure standpoint?
Yeah, well, I mean, clearly the best thing you can do for the prostate is to ejaculate.
Okay.
So the prostate, the only function of the prostate is to make semen. right? And so you have seminal vesicle that makes semen and the prostate that makes prostate secretions and semen. And so it's a gland. Just think of like the salivary gland makes saliva, the prostate gland makes semen. And so, and the semen obviously is like a very thick, viscous fluid. And so if it sits around for a long period of time, then the channels that it comes out through will get clogged. And so we see this when we do prostate surgery, like a TURP, where you're scraping away prostate tissue. And a lot of men will have a lot of prostate calcifications. So that's where those ducts or channels get blocked. The semen just sits around and eventually it gets calcified. And so definitely cleaning out the tubes is important. I mean, what
calcified, is that then painful when they ejaculate?
No, because it's just blocking. Well, I don't know. That's a good question. I don't think anyone's ever studied that, because it would be a challenging study to do. I would imagine that would cause some discomfort if the glands were contracting and being blocked. And certainly that can lead to enlarged prostate. That also can lead to a prostate that gets infected. And so before some of the stronger antibiotics that we have, that was the treatment for chronic prostatitis or prostate infection was prostate massage, basically pushing out the infected prostate secretions.
Okay.
And so that's like milking the prostate, basically. Could milking the prostate could be and feel different for a man than a normal ejaculatory orgasm.
Yeah. Well, when you're milking the prostate in a pleasureful way, it's a lot different than coming to a urologist like me, who's got big fingers and 12 patients in the waiting room, and I'm just trying to get you better and get the prostate secretions. It's
experience.
It's a relatively uncomfortable experience.
There's soft music.
No,
there's candlelight.
I don't send flowers the next day.
Luscious woman half dressed.
Yeah, no. You get an old, bald, pissed off urologist.
Well, I actually get a young client right now who's having issues with that. So it really can happen at any age. This sort of pooling of semen or calcification could take place if it pools for too long.
Well, is it semen or is it prostate fluid? I thought the semen was held in the balls and the prostate fluid was in the prostate. And in order to release semen, the prostatic fluid has to go into the testicles, and it does its chemical reaction, and then you have an ejaculation. Do I have that wrong?
Yeah, close. So the testicle makes sperm.
Okay.
The sperm swim through the epididymis, and the epididymis is where the sperm actually matures. So from the day you make sperm in the testicle, it takes about 75 days for it to mature and to be released. And so the sperm swim up through the epididymis and then into the vas deferens, and then the vas deferens joins the prostate and seminal vesicle in what's called the prostatic urethra. So the part of the urethral tube that's at the prostate level. And so during ejaculation, you get contraction of the seminal vesicle, contraction of the prostate, and that pushes the fluid, which is really high in fructose. Fructose is a type of sugar that the sperm kind of need that sugar to thrive, because they're whipping that tail around. They're swimming a long distance. They're swimming basically across the English Channel to get to the egg. And so that's the purpose of semen. And the sperm really only make up about 1 or 2% of the total ejaculation.
Oh, that's a lot less than I thought. Interesting.
Yeah. So like when we do vasectomies,
so mostly it's prostate fluid.
Yeah. So when I do vasectomies, prostate ejaculation, or ejaculation looks and feels the same, because the sperm are only, 1 or 2% of the total ejaculation.
That's interesting. Now, how often should a man be ejaculating in order to maintain prostate health and avoid this clogging?
Yeah. There again, I don't think anyone's ever done a real study on that, but at least twice a week, maybe.
Well, would you
Okay.
say it's different for different ages of men, or maybe different sort of biological, physical, like if they're really healthy and they're in their 60s versus, not healthy in their 20s?
I mean, I think in general to keep the fluid flowing at least twice a week is probably healthy.
Okay. I know there was I had something. We talked about the prostate. There was
Like
another
the chat
direction.
GPT of urology.
Or only question queen.
I put my arms out here, and it's like me giving wonderful prompts to the universe. Unfortunately, this doesn't always work.
Well, I want to hear about maybe some success stories. Like, like a guy comes in and he's just all down and out, really not having a good time with the penis.
Yeah. So, what I do, for me, the penis is a way to see a man's sort of general overall health.
Mhm.
There's for me, there's like this Maslow's pyramid of health for men over the age of 50. So for men, in their 20s, erectile function's easy. But for men over 50 to have a fulfilling sex life, at the very bottom, at the foundation, you need to have good physical health. And then you have to have good mental health, and you have to have good emotional health and financial health. And then at the top is really sexual health. And so men come into my office, for me to treat their erectile function, but I also treat their physical function. I also treat their mental health. I also, refer them to therapists for relationship issues and those kind of things. And so what's really gratifying to me is I see a man who comes in and then, I talk to them about their physical health, and I get them on eating better. I get them to stop drinking. I get them to stop smoking. I get them to lose 20 or 30 pounds. I get them into an exercise routine. I get them on good supplements. And then I get them on testosterone replacement. And then I'll get them on Affirm. I'll get them on some daily tadalafil. We'll do shockwave therapy. We'll get them with a penis pump. We'll do PRP. And 6 months later, they look like $1 million. They're, everything in their life is better, and they're having the best sex that they've ever had in their life. And that,
I love that.
and yeah, and that, that's really, really gratifying to me. And that happens fairly frequently in my office. And, the sad thing is, the way that our medical system is these days, you just don't, as a physician, you don't have enough time to spend with patients.
Mhm.
So, I mean, I had a patient who came in to see me for a circumcision, but he was 80 pounds overweight and drinking 8 beers a day.
Mm.
And I looked at him, I said, dude, I'll do your circumcision. That's fine. But, if you don't stop doing what you're doing, you're going to fucking die in 5 years.
Mm.
And he looked at me and he started crying. I'm
Aw.
like, yeah. And I was like, what's going on, dude? And he's like, I've been going to doctors for 25 years and no one's ever said that to me in a way that it just
Wow.
landed for me.
Wow.
Wow.
And I saw him back, 2-3 months after circumcision. He had stopped drinking 8 beers a day.
Wow.
He had already lost like 20-25 pounds.
Oh, yeah.
And, his whole life was turned around. And so sometimes it doesn't take someone with like extraordinary knowledge. Sometimes it just takes someone
Wow.
who's a professional
Yeah.
that cares enough to just pause and tell someone what they see.
Yeah. To like compassionately tell the truth in a way that like for this person
Yeah.
lands.
I mean, I'm sure like people in this guy's life were telling him, dude, you got to stop drinking, you got to lose weight. And it didn't really land. So sometimes, that's the privilege of wearing a white coat
Right.
Mhm.
and having fancy diplomas up on your wall, is that sometimes people will listen to you in a way that they don't listen to other people in their life.
Yeah.
And so to me, I consider it really a honor and a privilege. And I try to use that sort of pedestal to get people to see things that they don't want to see.
Yeah. Wow. That's a lot of responsibility too.
And to look more closely at their lifestyle.
Do you treat people with do people come in wanting help with ejaculatory control or delayed ejaculation, where they're just having a hard time getting over that climax hill?
Yeah, so I treat people with premature ejaculation. They tend to be younger patients, and I treat patients with delayed ejaculation, tend to be older. So for guys with premature ejaculation, the delay sprays like Promescent are really useful. I also have a supplement called Prelong.
What's Promescent?
Promescent, it's like basically a topical numbing cream.
Mm.
There are wipes, there's creams, there's sprays. I find that Promescent sticks to the penis a little bit better.
Okay.
Over the counter or prescription?
Over the counter.
Yeah.
And then I have a supplement called Prelong, which is an extract of St. John's wort. St. John's wort is a natural selective serotonin reuptake inhibitor. And so what we found is that the antidepressant medications in the class of selective serotonin reuptake inhibitors, SSRIs, delay ejaculation.
Right.
But some people don't want to be on an antidepressant.
Yeah, but
there's a
they'll
lot of
take
stigmas and side effects of those. So Prelong, which you can also pick up at affirmscience.com, works really well. Or you can go on an antidepressant. Or there's one called Prilogy, which unfortunately is not available in the United States, but it's a short-acting 1 to 3 hour window. And so I have patients who get it from India, they get it from England, and you can take that 1 to 3 hours before, and that will delay ejaculation. Now, on the flip side, you have guys that take a long time to ejaculate. And so sometimes testosterone is good for that. If you have low testosterone levels, boosting testosterone will boost libido, which then will increase excitation, and guys will be able to ejaculate. There's a medication called cabergoline, which works on the dopamine supplies in the brain. And then there's a device called the Emsella chair. And so I actually did the original research, which showed that it improves ejaculatory function. So 10 treatments. So the Emsella was actually developed for women for treating stress incontinence. And then Kim Evans, a friend of mine, did research on women that showed that it improved sexual function by improving the strength of the vaginal tissue.
Did you say Emsella chair?
Yeah.
Is it a chair that you sit in?
It's a chair that you sit on. But it's basically you're sitting on a giant magnet. And when you run electricity through a coil, it creates a magnetic field, and that magnetic field contracts the pelvic floor, kind of like you're doing a Kegel exercise.
So it's for you. It's getting.
But it's 20-fold stronger than you could ever do on your own.
Oh, does it hurt?
No. Feels actually.
Yeah, I was to say that might feel nice.
Yeah, no, it feels good.
Yeah.
When I have paperwork on the weekend, I come in, I sit on that chair, I get a pelvic floor workout, and I get my paperwork done.
Nice.
I'm an efficiency. I have 4 kids, 3 companies, 2 houses, and 1 wife, so I have to be super efficient with my time.
Evidently. Wow. Well, this has been so fascinating.
Yeah.
Dr. Willow, do you have any final questions?
I don't. Thank you so much for coming on the show, Dr. Brandeis. It was such a pleasure to just pick your brain for an hour and learn about all this amazing stuff. And the 21st Century Man, it is all in the book, soon to be coming out in podcast form.
No, we're already out.
What's the name of the podcast?
It's the 21st Century Man. So if you go to Spotify and just put in the 21st Century Man, or we're on YouTube.
Have to read. We can just listen to the podcast now.
Yeah. Well,
do both.
Do both. I don't know. I'm old fashioned. I like to have a book. Yeah, a book in my
I actually
hand.
like to read a book and listen to the book at the same time.
Ooh, that's good.
Yeah. Well, we'll have all those links in the show notes, friends.
Awesome.
Remember to please stay tuned, because up next you've got me and Dr. Willow dishing it up, and we look forward to that. And have a beautiful day. Thanks so much for joining us.
Oh, thanks for having me. I appreciate it.
Now, our favorite part, the dish.
Well. We've had so many great, interesting sexual health doctors recently.
We have. been fun. I love it because we get such a good education. I mean, that was fast. I didn't realize that only 1 to 2% of an ejaculation is semen. How did I not know that?
I know. That's fascinating. I had no idea either. I thought there would be a much bigger volume.
It's mostly prostate fluid. So, and this is something that I've actually been wanting to talk to you about privately. But since we're here privately talking, with milking the prostate, what is coming out is primarily prostate fluid.
My understanding was that it was prostatic fluid. Yeah.
Okay, because I was totally not
But it sounds like that it's also semen.
1 to 2%.
And what I thought of as semen, I was equating with sperm. But it sounds like they're actually 3 different things. You have sperm, semen, and prostatic fluid. And the prostate is what creates the semen and the prostatic fluid.
Okay. And we're going to have to listen to that little portion again because that was really good education. Yeah. So Dr. Brandeis, what an amazing urologist to know about, y'all. What an incredible guy. Like, yay for the penis man.
Yeah.
Making everyone have a better relationship with their cock. I love it.
And for those of you who are in California or near the Bay Area, he would be in your backyard. But it sounds like he's got other clinicians that he's trained who can also help with some of the things that he's created. Really great that there's a more natural way to have permanent.
Yes.
Extra girth, extra length. I mean.
Yeah, exactly.
You know. I can just see how many men would invest in that if they had the chance to just up their confidence by another inch. I can't tell you how many people I know would say yes.
I know exactly, but I imagine too, if we're increasing length and we're increasing girth, we've got to be increasing sensitivity as well, because there's that much more cellular tissue for blood to be flowing through. So going to be increasing sensitivity. So
I never thought of it that way.
Going to be feeling better too. Not only are you going to have more confidence in the way that it looks, but also in the way that it feels, and probably in your control as well. I mean, I do know that Leah and I are experts in teaching control, but I think the confidence is a huge part of being able to be in choice. I like the word choice a little bit better than control.
Yeah, if I do go down and get on that magnet chair he was talking about, I want to talk to him, if I could have a few more minutes of his time, and explain the interventions that we have so much success with when it comes to teaching men ejaculatory choice by working with muscular contractions, pressure points, and breath control. Because again, it's a non-invasive way of actually getting some really great results. I would much rather teach somebody that than give them a spray.
Yeah.
And God knows what that spray tastes like.
Just so y'all know, if you don't know, Leah is not into yucky tasting medicine.
No, I don't like yucky taste.
That's not like the taste.
Nothing bitter, especially.
Well, yeah, I actually wanted to ask him that and I just didn't. But, do you ever refer to dakinis? Do you ever refer to tantrikas who teach men like hands-on how to use their own system, sound, breath, body control, running energy through your meridians? I mean, it would be interesting. I think I did ask one of our doctors at one point that we had on the show that question, and they were like, never thought of it.
Yeah. Right. I think that was Dr. Gittins. And I got the vibe from him too. This is not something he would
that's why
typically refer. It's like, I think some of those physicians are like, I don't want to sound judgy, but there is a certain academic thing that they feel like that's the only thing that has credibility.
Yeah.
Because they know they've been through so many years at a university and they've have, clinical measurements and things. So there's a statusizing when it comes to the type of education that you've had. And there's a lot of people that dismiss.
Some of them can. Although I will say for Dr. Brandeis, he was very receptive and very open and pretty playful, I thought. And when he did it,
it's always Dr. Gittins, honestly.
He wasn't afraid to
generous.
admit it,
Mm-hmm.
It was nice.
Yeah. And I think I think we asked the same question to Dr. Elliot Justin, who I was thrilled that he mentioned
Yeah.
because he loves Dr. Justin's cock ring
Yeah.
that we were so impressed with.
It's an amazing fucking cock ring.
Yeah, I really, if you haven't listened to either of those episodes, go back. I'll put the links in the show notes because it would be really interesting to get some feedback from you, listeners, about what landed with you, because each one of these doctors touches on many of the same themes. For instance, Dr. Gittins is really all about the injections for increased girth, the filler injections, and has had great success in his office. So it's really interesting what Brandeis had to say, and his alternative that he's getting a lot of success with.
Yeah.
So, and then not to mention Dr.
Ann Trum. Yeah.
Yeah, who spoke in depth about the stem
You get
cells.
a full education on prostate and penile health by those 3 episodes alone.
Yes. And, I think one of the things that might be a turnoff if I was considering the P-long treatment that he has is just, although he did say it's just a half hour in the morning and a half hour in the evening, but it does feel like a lot of steps.
Yeah.
But then again, it's permanent.
Yeah.
So maybe, it's 6 months and you get a permanent result, and it takes an hour a day of an investment, and you got to go into the office to get those injections. I don't know. How important is it to you?
Yeah, exactly.
Yeah. Well, this was
Right,
fun.
Paul. Yeah.
Okay. Love, love, love.
See you soon.
Thanks for tuning in. This episode was hosted by Tantric Sex Master Coach and Positive Psychology Facilitator Leah Piper, as well as by Chinese and Functional Medicine Doctor and Taoist Sexology Teacher Dr. Willow Brown. Don't forget, your comments, likes, subscribes, and suggestions matter. Let's realize this new world together.
Hey guys, what would it be like if you could last 10 times longer when you're having sex?
We are going to teach you how to gain massive confidence as a lover, all without performance anxiety, gimmicks, or prescription.
This course is perfect for you if you've ever been mortified by a sexual encounter that ended way too early.
Or if you've ever avoided intimacy out of fear that you won't last as long as your lover desires. Or maybe you long to give your partner multiple orgasms but can't last long enough to make that a reality.
Well, good news, we've got your back, and it's in our course, Last 10 Times Longer. Go to sexreimagined.com/last-10x-longer.
And for all of our favorite listeners out there, we are giving you a discount, 20% off, y'all. Just put in podcast 20, all caps, podcast 20, to get your 20% off of this phenomenal course that you're going to want to review more than once.
We cannot wait to see you inside this course. Plus, don't forget, we always got tons of bonuses. See you there.